Everyone, and welcome to another session of A Day with your fertility specialist. My name is Precious Adama, and I'm going to be your host for today. Thank you so much for tuning in. Thank you for your likes, your comments. We really, really appreciate. On today's episode, we're going to be talking about stress urinary incontinence. That is understanding urine leakage in women. I'm sure most of us must have come across the word sometime in our life, being simply put, the inability to mitigate the outflow of urine. But today, we're going to be delving a bit deeper, understanding what it is, who it happens to, and how it can be prevented. So stay tuned, share with your families, your friends, so they too can be part of this session. So to elaborate more, we have with us Dr. Jane. Good afternoon, ma'am.
Good afternoon, Precious.
So for the sake of someone joining for the first time, Dr. Jane, she's a gynecologist, a minimal access surgeon, and a fertility expert. So feel free to bombard her with all your questions. All the answers are here. Welcome, Dr. Jane.
Thank you.
So by way of introduction, for someone hearing this for the first time, what exactly is stress urinary incontinence? We're going to be using SUI subsequently before I bite my tongue. So what exactly is it? So somebody hearing it for the first time, a layman, what exactly is this condition?
Stress urinary incontinence is we'll put it like an involuntary leakage of urine
Okay.
when there is increased pressure on the bladder. So it's like you said, it's an unplanned leakage of urine, and this commonly happen when you laugh, when you cough, when you sneeze, when you lift heavy objects. Those are the common times you will see that, and this happening because normally when you sneeze and do all of those, there's increased pressure in your tummy or your abdomen.
Wow.
So, and the floor, there's what we call the floor, the pelvic floor. That's is a protective mechanism, and when that pressure increases, it causes the outlet or the valves for the bladder and the urethra, which is the conduit that takes the urine out. They gets constricted or locked, so it prevents leakage. So if there is weakness on that floor, it doesn't perform that function. So once you have anything that will cause an increased pressure in your tummy, which transmits to the bladder as increased pressure, can actually cause this involuntary leakage of urine, stress urinary incontinence. Not necessarily stress on the bladder or emotional stress.
That's what I
was
was
stress. Yes.
Stress. Okay. So the stress is, I was thinking like, is a stress induced mechanism or something? Maybe like a psychological, physiological stuff?
No, it's not. And that's why I had to. It's not an emotional stress. It's just the pressure that the bladder and urethra, they can't withstand it. So they allow these parts of urine.
Okay. Thank you. So, but why can something as simple as coughing, sneezing, or laughing cause this urine leakage? Like, what is happening anatomically in the body that is causing this?
Okay, so the same thing we have said. So all of this will cause pressure, increased pressure, even conditions like chronic constipation and repeated straining, weight gain. All of those things can lead to increased pressure in the abdomen or tummy, as we would want people to get it better. And if this mechanism of open and close, which once the pressure comes, have you, I want to put it this way, have you ever, maybe we should ask if some women, what they do when they try to sneeze, they cross their legs.
Yeah, I've actually heard.
Yes, so like that is a way of stopping that. Now, naturally, in the resting state, once the pressure increases, the valves, all those outlets of the bladder, the urethra, they are locked. So it prevents that leakage. So once that mechanism is weak, is not effective, not efficient, there's tendency to have those leakages. So the cough, yes, you say cough is from the chest, but that's when you try to cough, you see that the tummy gets some pressure. If you cough, you see the tummy gets big because of pressure. Same
Okay.
thing with lifting heavy objects, same thing with straining. So the mechanism is the same, except for some other conditions that will cause that, like
Okay.
women in their menopausal stage. Naturally, because of deficiency of estrogens, there's weakness because estrogens also supports that flow.
Okay.
Yes, then
Wow.
for people that have prolapsed organs, that have had some kind of surgeries and all of that, yes, but the major mechanism is this pressure and weakness working hand in hand.
All right. Thank you so much for that definition. It was very clear and understandable. So, what exactly causes this SUI? Is it like, is there something that causes it?
Well, you nothing particularly will say causes stress urinary incontinence,
Okay.
but there are some, we'll say, we call them risk factors. So
Okay.
someone can have four factors that will and risk factors are things that predispose you to a condition. So someone can have two of them, someone can have three.
Okay.
So let's take, for instance, childbirth is
Oh,
a risk factor
factor.
because of the pregnancy alone and the hormonal changes causes a strain on that floor. Then the birthing process causes some tear, some stretch, what some people call wear and tear on
Yes.
that floor. Now, if the vaginal birth, the process, the birthing process now comes with very big babies, some obstetric procedures like maybe instrumental birth, all of those further increases your risk of having this stress urinary incontinence.
Incontinence.
But it doesn't mean that people will now have to go for a cesarean section to avoid that, right?
Okay.
It's something that is common, and that's why I have tried to mention some of those risk factors. I talked about chronic cough. So now when we mention cough, the cough has come from a chest infection or any form of infection.
Okay.
Constipation with repeated straining, um, obesity, right?
Obesity.
Yes, that it can lead to that. Then menopausal state we have explained, reduced estrogen, reduced support to the floor. So the floor, as we have explained, yes. Then when you've had some pelvic surgeries, yes, then sometimes the support system of your uterus, your ovaries weakens, and you tend to
Okay.
have them protruding through the vagina, what we call a
Wow.
pelvic organ prolapse. It can also lead, it predisposes you to having stress urinary incontinence. So most times there
Okay.
are risk factors. So of course, so management will now be likewise.
Wow. Okay. Thank you. So, from all these risk factors that you've mentioned, is it safe to say that SUI is largely associated with age?
Well, it's not an age dependent thing.
Okay.
Yes, commonly we see it in older women,
Yes.
but in younger people, because there's also a genetic risk. Then people that have collagen is supposed to support the structures in the body. People that have collagen deficiencies too can also
Okay.
come down with that. So you see a younger person can also have stress urinary incontinence. But for obvious reasons, the older age group would have a lot more of that.
All right. Thank you for that. So, is occasional urine leakage normal, or should any leakage prompt someone to seek medical care?
Well, occasional urine leakage, like
Mm.
we're talking about stress urinary incontinence and maybe some other forms of incontinence,
Yes.
should prompt medical care because you don't want to if someone a woman doesn't understand the cause of her urine leakage because you put it broad urine leakage.
Yes.
Yes, if you don't understand the cause, you might not be able, you cannot manage it because you only manage when you have found the cause.
Yes.
Yes,
I
so urine
understand.
leakage can be from stress urinary incontinence. You can also
Okay.
have what we call urgency incontinence. You can have an overactive bladder. Some can even have a
Okay.
fistula and they keep leaking urine. You can even have an infection in the bladder. So you
Wow.
see that any urine leakage that can affect your life, your productivity, that makes you plan your life around your bladder. Like, I don't want to go far, I might feel pressed. There's no restroom in that place, I'm not going. I have to
Okay.
take 4 parts. You know, people plan their life
Yes.
around some events like that. any of them that gives you those kind of concerns is worth looking at. Yes, even though urine leakage is not life-threatening, but it can affect quality of life significantly, and it's important that women seek help when they have it.
Okay. So how common is this condition? And most women don't really talk about it. So how common is it?
Yeah, it's quite common. Yeah, it's quite
Mhm.
common. But you see, a lot of times people assume is a pathway, is something that you get to experience
Okay.
towards your menopausal ages
Ages.
and all of that.
Okay.
So people
Yes.
don't talk about that. But again, the aim of this discussion should let women know that anytime you talk about urinary incontinence, be rest assured that your doctor have heard 1,001 times about it. So every woman should seek care whenever this affects the quality of your life.
All right. So many people have tagged vaginal delivery as the main culprit that causes this. Is that true? Like,
No, yes, even though vaginal birth is there as one of the causes, I talked about the
yes.
wear and tear on the pelvic floor and other events that happen around delivery. But again, we have mentioned some other factors: menopausal states, all those chronic cough, lifting of heavy objects, even genetic predisposition, collagen deficiency, and all of that.
Okay.
So, one person might have stress urinary incontinence from multiple risk factors. Yeah.
Wow. All right. You spoke about it being genetic. Can you throw more light on that?
Yeah,
Uh,
so it's still the collagen
okay.
deficiency. So if you
Okay.
have those genetic predisposition,
Okay.
yes, yes, because it's same for same reason. You would expect to see a prolapse in an older woman, then you see a young girl of 17 with a
Wow.
prolapse. Yes, something of that sort. Yeah.
That's actually quite serious. Okay. So how does age, menopause, and declining estrogen levels affect the pelvic floor and bladder control?
Age,
Yes,
menopause, and
declining estrogen levels.
yeah, so they are all in the spectrum.
Okay.
So a woman is aging, she gets to her menopausal age, and at
Mhm.
menopause, we have reduced ovarian activity. It means
Okay.
the ovaries are not producing enough estrogens. So now these estrogens are supposed to give some strength to the pelvic floor. So aging,
Okay.
menopause, reduced estrogen production, weakened pelvic floor, and by extension, stress urinary incontinence.
Incontinence. Okay. Can it be completely cured? This condition that we talk
Yes,
about,
yes,
it can be
it
cured
can be
completely.
managed significant to satisfaction to a client. I would
Okay.
say managed. Yes, I'll prefer the word managed, right? Because can manage all through what we call conservative care. There are drugs, medical
Okay.
care, and again for those troubling incontinence, you also have surgical procedures that can be done
Wow.
for them.
So this
Yes.
surgical procedure, do they stop it completely, or it's still a way of managing
They
it?
can significantly improve your symptoms. And again, the goal is to improve your symptoms and
Yes,
improve
definitely.
quality of life. And if the surgeries are well done, the symptoms should not be seen. But remember, we have talked about multiple risk factors.
Okay.
So if we're improving, giving estrogens to improve pelvic flow, chronic cough might be there and all of that. So
Okay.
if you manage the symptom, the risk factor, treat the cough, do some weight loss therapy, do some pelvic floor strengthening, all of those would improve your symptoms significantly. So, yes, treatment is in that order. So,
Okay.
women can feel better and more confident when they step out.
All right. Thank you. Speaking of pelvic floor strengthening, some people are of the opinion that pelvic floor exercises can actually help with this condition. How true is that?
Very true. If
Okay.
it's said to be the first line of what we
Wow.
call, when they say conservative care, you are
Mhm.
not giving medication, surgeries, you are doing things that would improve without intervening. So, pelvic floor strengthening is very important, commonly called Kegel's
Yes,
exercise.
Kegels.
Yes, it's the
Yes.
first line and it's very effective.
Wow.
Yes, you don't see results in the first month, but if you keep doing it correctly, because that is where the problem is. A lot of times, these exercises are not well done. A lot
Okay.
of times, women don't know the muscles to contract.
Oh.
Yes, so once you learn the muscles to tighten and release, let me use that word instead of
Okay.
contract, tighten and release, it's very effective 2 3
Okay.
months down the line, your symptoms would have significantly improved.
Wow, that's very interesting. So with these exercises, they don't really need any medical attention if you are doing it correctly.
Yes, if you do it
Wow.
correctly, so long as it's just stress urinary incontinence, you
Okay.
don't need any further care. And that is why, in management of patients, you do with the least invasive, least anything that would affect the woman's life or something. So you are doing something not affecting her.
Okay.
So strengthening of the floor is she will do it herself. She'll sit at home, contract her while she's at work, moving around. She just
Yes.
remembers she keeps doing it during the day.
Okay.
So that is very effective. Irrespective, once you can do that, you don't need any other form of treatment. So if when conservative doesn't work, then
Yes.
you now go to drugs, medications.
Yes.
Then when medications don't work, you now go to surgeries. And of course, you have to establish that you are managing just stress urinary incontinence. Because if you are leaking urine from other forms like urge incontinence, overreactive bladder,
Okay.
those have to be managed alongside. If you manage one and leave the other, then
Yes.
you might not achieve the treatment satisfaction you hope
Okay.
to see. Yeah.
Wow. Okay. Thank you very much. So there has been some controversy around surgical treatment for this incontinence. How should patients approach these options and make informed decisions?
Yeah, so you see, when a woman has this concern of urinary incontinence, you need to have a conversation with her.
Okay.
You need to know the type of incontinence she has and what we call history taking,
Okay.
right? So when you do that, you can decide on what will work best for her. Now, taking surgery as an option should be the last step.
Okay.
Most times, as I explained earlier, conservative treatments are very effective. Treatment of the Besides the pelvic floor strengthening, you also have treatment courses. With constipation, you give things that improve and reduces straining. You treat the cough, do
Okay.
weight loss therapy. Yes, manage fluid intake and fluid intake. Then also you can give them what we call a bladder diary so that you can monitor the times they usually have these symptoms. You be sure that
Okay.
that is what you're managing. So if you can do that, you can now move if it doesn't work. But if a woman outrightly wants the process to just go away, but
Yes.
she has to understand that just Kegel's exercises can
Can
take
do a
care of her
lot.
symptom. Then, if she has that understanding and still wants to go ahead with surgery, she can have that option so long as that procedure is available for her to get it at the time.
Oh, thank you. I think you've made mention of weight a couple of times now. How exactly does this obesity affect?
Yeah, so obesity,
Yes.
when you are with a very large weight, you
Mm-hmm.
tend to be it has pressure, activity, your own, you
Okay.
know, yes, the whole activity for is a smaller BMI
Okay.
or BMI than a bigger BMI. The activities differ, so weight gainers can also do that, yes,
Oh,
significantly,
okay.
because the stress on your organs, the bladder, is way more than
Yes,
what you
with
put
weight.
on.
Oh, all right. So we'll just be talking about some myths, like some preconceptions that people have regarding these conditions. You're either going to be affirming or debunking everything that they've said. So I'll just ask the questions. So some people are on that people who hold in urine for a very, very long time and go and eat, they say where they're already almost exploding, they're at risk of developing SUI. Is that true?
That's not true.
Okay.
Yeah,
It's not true at all.
it's not true.
Good.
Yeah,
So
so SUI, basically those risk
it
factors.
doesn't
Yes,
have
holding urine
anything.
for long can keep the urine there for a longer time, increasing your
Okay.
risk of infections and all, but not a stress urinary incontinence.
Okay. Risk for infection. That is the only cause.
Yes.
Okay. Just asking for a friend. All right. So this drinking less water will stop leakage. True or false?
Well, now the leakage, we have talked about things. So once your bladder has urine, if you
Yes.
sneeze, cough, anything that causes that pressure to hit your bladder, make you leak urine. Now, drinking less water, the way it works is that it now gives you urine per time. So
Okay.
you don't feel you don't have a lot in your bladder. So you have leakages that are less compared to
Okay.
someone with a fuller bladder. Remember, as the bladder keeps filling up, the pressure keeps mounting, and that
Yes,
pressure is what
definitely.
it used to, like your word, you said, explode, right? So the less fluid you
Okay.
take, the less urge to urinate, the less in your bladder also leak. Since not a because we have continuous leakage, so there are people leak urine with or without any effort.
Okay. Okay. Another myth: having a C-section prevents you from SUI. True or false?
Not true.
Okay.
Remember, we've established there are multiple risk factors.
Yes.
Rather, in fact, some people have propagated that even C-sections doesn't prevent stress urinary incontinence from the procedure alone.
Okay.
Remember, when you make those incisions, some nerves are tampered with, and they can also affect the pelvic floor. Some
Wow.
people, yes, some researchers believe that that can even predispose you alongside to stress urinary incontinence. But
Okay.
for your myth,
Yes.
no, it doesn't prevent you from
From
having a
having.
stress urinary. So women should not advocate a cesarean section because they want to avoid stress urinary incontinence.
Okay. Thank you. So the next one: SUI means that you have a urinary tract infection.
So that is not true again.
Yeah.
Yes, but SUI, urinary tract infection, can present like some stress urinary incontinence, and that is why conversation, pain when you're urinating, frequency, blood in urine, all of those have to be established before you can say a woman has stress urinary incontinence. So it
Okay.
doesn't mean you have
A
a
UTI.
UTI. They are different entities entirely.
Okay.
Yes.
So false. All right. The last one: Kegel exercises can cure the condition.
Okay.
Cure is the main
Yes,
word.
so Kegel's exercise can improve your symptoms up to a significant percentage.
Okay.
For cure, yes, we don't have it 100% of the time, but it's a way to manage the condition to significant satisfaction of a woman.
Okay. All right. Thank you very much. So, what advice would you give, lastly, to women? I know this condition seems like something that you want to be shy to talk about. You are leaking urine. So, most people do not understand what it is. What advice would you give to people that are going through this condition and they are afraid to speak up, thinking something terribly wrong with them?
All
Hmm.
right, so to the woman out there that could be going through stress, that could be having stress urinary incontinence, it's not a life-threatening condition, and it doesn't mean you
Definitely.
have any serious urinary condition. It's something that's from our explanation, you have either one of two of the reasons. But once this leakage can affect your life, your activity, your quality of life,
Okay.
it's a good time to seek help. The way you feel your urinary incontinence and another woman, they might not be in the same, but
Yes,
whichever. So you are
definitely.
going to be the individual that determines, I don't want to plan my life around that. So you
Yes.
seek medical care. You having this with just Kegel's exercise, not so much, you can improve symptoms significantly. And remember
Okay.
that urinary symptoms are things the doctor hear every day. So no one should shy about it. It's something that you can get treated, you can get cure, and you feel better again.
Okay. Wow. Thank you so much, Dr. Jean. This was an insightful session. Thank you so much for having us. And to all our viewers, thank you so much for sticking around. I'm sure we've learned a lot of things today. Thank you so much. Get to catch us next time. Remember, we do this every Wednesdays and Fridays. The time. Thank you so much for sticking with us to have a blessed day ahead. Thank you.